Hello everybody. Today let's talk about a problem that's much more common than you might think. Hemorrhoids. Hemorrhoids can be really uncomfortable, even painful. But for many patients, dealing with troubles in such private areas is also shameful, so they don't easily search for help. Some people even try really hard to get them solved, looking for recommendations in Google and using over-the-counter creams from the pharmacy. Now, to help you understand what are hemorrhoids and most importantly, when to look for a proctologist consultation. What hemorrhoids are and how common are they? Hemorrhoids are veins that we all have in the anal canal and perineal areas. You can see them here represented as these purple lumps. Here is an external one and here is an internal one. They get swollen and start creating problems. Statistically, about 50% of people over 50 years have experienced hemorrhoids in some form. Most people can manage hemorrhoids with simple treatments like fiber, sheet baths, and ointments, but sometimes they keep coming back or won't go away. Now, types of surgical options for hemorrhoids. Let's go over the most common surgical options and what it involves. Knowing what's available can help make the idea of surgery less intimidating. First, hemorrhoidectomy. This is the most effective option for large hemorrhoids that cause a lot of pain. In this surgery, the doctor removes the hemorrhoid tissue completely. While the recovery takes a few weeks, it has a high success rate in the long term and very low chance of hemorrhoids coming back. Now, I know that sounds daunting, but with modern pain management techniques, we've made the recovery smoother than ever. Second, laser or infrared coagulation. For patients with smaller internal hemorrhoids, we sometimes use laser or infrared technology. This procedure uses heat to shrink the hemorrhoid tissue. It's less invasive and offers a quicker recovery, but it's not as effective for larger hemorrhoids or for the long term. Of course, this technique is less painful than the classic surgery, but you will feel some discomfort for a few days, typically starting the day 4 or 5 after the surgery. Third, transanal hemorrhoidal dearterialization, THT. When the hemorrhoids are large and prolapsing but there is no external component, we can use this technique, where with the help of a Doppler ultrasound we localize the roots of different hemorrhoids, usually 6 different roots, and we suture at the spot to cut off its blood supply. Usually we complete the surgery with apexia, that means to suture the hemorrhoid up in the rectum so it will stop going out. When do hemorrhoids become severe enough for surgery? Hemorrhoids are classified by grades from 1 to 4. Grades 1 and 2 hemorrhoids are often smaller and don't stick out from the body. They usually respond well to at-home treatments, although sometimes may also be very annoying, needing some kind of surgical management, especially when they bleed. However, when we reach grades 3 and 4, things start to get more complicated and these hemorrhoids are usually larger. They prolapse or extend outside the anus and can be very painful or bleed persistently. Let me know in the comments if you've ever been confused about what grade your hemorrhoid, or if you might knew there were grades at all. Grade 3 hemorrhoids may need a more hands-on approach, such as Doppler guided dearterialization, also called THT, a method where we use the help of a Doppler ultrasound to localize the roots of different hemorrhoids and we suture them at the spot to cut off the blood supply, or classical hemorrhoidectomy, which will completely remove one or several particular hemorrhoids, suturing its pedicle and either keeping the wound open, which is called Milligan-Morgan technique, or closing the defect, is called Ferguson technique. Grade 4 hemorrhoids, however, are often, but now the question is, why consider surgery at all? There are some signs that it's time to take that step. Many people manage hemorrhoids successfully without surgery, but here's when surgery becomes a serious consideration. Persistent bleeding. If you are noticing ongoing bleeding despite treatment, it could lead to anemia over time. This can be especially severe in case of a coexistent cardiac condition. Chronic pain. Severe daily pain can be a sign that conservative treatments are no longer effective. Prolapse. If you experience a prolapse that you need to reduce with your hands every day, or maybe you can't even reduce it with your hands. Impact on quality of life. When hemorrhoids interfere with your daily activities, it's a sign that surgery might be a good option. If any of these points sound familiar, don't ignore it. Your quality of life matters, and sometimes surgery is the best way to get relief. Prepare for surgery and what to expect. Now, if you and your doctor decide that surgery is the best option, there are some steps to prepare and expectations to set. Let's start with preparation. We'll likely discuss your medical history, current medications, and any allergies. Some patients will need a colonoscopy beforehand, especially if there has been rectal bleeding, just to rule out there are other conditions. Recovery time depends on the type of surgery. For a classical hemorrhoidectomy, you may need 4 to 6 weeks to heal fully, while with laser surgery you could recover in around 2 to 3 weeks. Diet and hydration play a huge role in recovery. A high-fiber diet, plenty of water, and a stool softener can help make this process smoother. How to prevent future hemorrhoids? As I explained at the beginning of the video, the hemorrhoids are there for a reason, therefore, we can't simply make them disappear completely. And here it comes one of the difficulties that proctologists face. To treat the hemorrhoids enough for them to stop bothering, but not too much so we avoid complications. Now, although some cases are related to congenital predisposition, when hemorrhoids start to bother, it's usually because we are doing something to, let's say, wake them up. Most commonly regarding our diet or the consistency of our stool. Sometimes it's related to overweight or pregnancy. As you can expect, if the same triggers continue to happen, the non-treated veins or even the treated one may respond again. And that's why even after surgery it's smart to make a few lifestyle changes to keep hemorrhoids from returning. Here's what we'd focus on. Increase your fiber, having a diet full with vegetables and fruits, keep bowel movements regular and reduce straining. Stay hydrated. Drinking enough water keeps the stool soft and prevents constipation. Avoid long periods sitting on the toilet. If you need to, use the 2-minute rule. Exercise regularly. Being active improves blood flow and helps with digestion. Did you know that increasing your fiber intake to the recommended levels can reduce hemorrhoid recurrency by up to 40%? So, when is the surgery the best option for hemorrhoids? In short, if conservative treatments have failed, if you are dealing with grade 3 or 4 hemorrhoids, or if your symptoms are significantly impacting your life, surgery might be worth considering. I hope this video helps you feel more informed. If you found this helpful, please subscribe, like, and share with anyone who might benefit from this info. And if you have any question, leave them in the comments below. I'm here to help. Take care.